So through 1 year, the Q16 and Q8 arms received about 5.5 and about 8.5 aflibercept injections, compared to obviously none in the sham arm. And then at the 1 year time point, about 65 and 80% of the Q16 and Q8 arms improved 2 or more steps on the DRSS, compared to 15% with sham. So highly statistically significant differences favoring the aflibercept arms, meeting the 1 year primary endpoints. Actually, both arms were their own primary endpoint compared to sham. So 2 primary endpoints at the week 52 mark. No, I love it. And just to get into the secondary endpoints briefly, because that will answer the question, you know, it's interesting, doctors and patients, at some level, does it really matter what the color fundus photograph looks like? Does it really matter how many hemorrhages a patient has? It's certainly a debatable question, but certainly I think what we all care about are the vision-threatening complications, proliferative disease and DME, and there was a highly significant difference between the arms. So about 41% of the sham eyes developed proliferative disease or center-involved DME, compared to 8 to 11%, about 10% of the aflibercept dose patients. So a 75% reduction in the development of these vision-threatening complications with treatment. So clearly, through 1 year PANORAMA, we saw highly effective treatment with anti-VEGF aflibercept dosing, both in improvements in retinopathy severity scales, but most clinically relevant reductions in the development of these clinically relevant endpoints. And so to answer your question directly, I think the most valuable thing that this trial does, the PANORAMA does, is it gives us data to inform our discussions and our management decisions with patients. Does this trial mean that every patient with NPDR without DME should be treated with anti-VEGF injections? I think the answer to that has to be individualized. Every eye needs to be considered separately in the context of the complete patient. But it gives us data that if you do treat these patients, you significantly improve their anatomic outcomes at least through 1 year. And ultimately, this is a 2-year trial, so we'll have more data forthcoming.